All right, let's jump right in. Today, we're going deep inside the lungs to understand a battle that millions of people are fighting every single day. We're talking about chronic obstructive pulmonary disease. You've probably heard it called COPD. It sounds complicated, I know, but we're going to break it down so it all makes sense. So, just to give you an idea of how big a deal this is, let's start with this number 3.2 million. That is how many people died from COPD across the globe in 2015 alone. It is literally the third leading cause of death worldwide. So, yeah, understanding this is absolutely crucial. Okay, so what is actually going on here? The heart of the problem with COPD is something called persistent airflow limitation. Now, what does that mean in plain English? It means it gets harder and harder to breathe out. This isn't something that just happens overnight. It's the damage that builds up from long-term exposure to nasty irritants. And you guessed it, cigarette smoke is far and away the biggest offender. So here's the official definition. COPD is a common and, this is a really important word, treatable disease. It's defined by that progressive airflow limitation we just talked about, and also tissue destruction that comes from chronic long-term inflammation. The key takeaway? Yes, there's damage, but the disease can absolutely be managed. Now, here's something you might not realize. COPD isn't just one single thing. It's really an umbrella term for two major problems that are often happening at the same time in the lungs: chronic bronchitis and emphysema. Think of them as two different battles being fought on the same territory. And this chart just lays out the difference perfectly. On the one hand, you've got chronic bronchitis. Here, the issue is with the airways, the pipes that carry the air. They get inflamed, they get narrow, and they get all gunked up with mucus. Then, on the other hand, you've got emphysema. This is a problem with the tiny little air sacs at the very end of those pipes. They get damaged and lose their stretchiness, their elastic recoil. Let's dig into chronic bronchitis for a second. The best way to picture it is honestly like a clogged drain pipe. After years of irritation, the glands that make mucus just go into overdrive, producing way too much of it. At the same time, the walls of the pipes get thicker. The result? It's a super narrow, gunked-up pathway for air to get through. So what about emphysema? Well, think about a brand new rubber band. It snaps right back when you stretch it, right? In emphysema, the stuff that makes the air sacs stretchy, it's called elastin, gets destroyed. So those little air sacs become like old, worn-out rubber bands. Air gets in okay, but they've lost their springiness, so they can't push all the old air out. That's what we call air trapping. Okay, so we have these two different things happening on the inside, but what does that actually look like on the outside in a person? Well, this leads to two classic, though maybe a little simplified, pictures of what a COPD patient might look like: the blue bloater and the pink puffer. Check this out. The blue bloater is when bronchitis is the main issue. Because of those clogged airways, they really struggle to get enough oxygen, which can give their skin a bluish tint. That's called cyanosis. They've got that nasty, productive cough from all the mucus and tend to hold on to CO2. Then you have the pink puffer, where emphysema is the dominant problem. These folks work so hard just to breathe that they often become very thin. They use this technique called pursed lip breathing to help keep their airways from collapsing, and they can actually keep their oxygen levels looking pretty good, at least in the beginning. So seeing these signs is one thing, but how does a doctor know for sure? How do they get a concrete, objective diagnosis? Well, they rely on this one really critical test that measures exactly how bad that airflow limitation is. And that test is called spirometry. It's actually a pretty simple idea. You take the biggest, deepest breath you possibly can, and then you blow it all out, as hard and as fast as you can, into a machine. The machine measures two really important things: the total volume of air you blew out, that's the FVC, and how much of that air you managed to get out in the very first second, that's the FEV1. And the key is the ratio between those two numbers. And it all comes down to this number right here, less than 0.7. If the ratio of the air you can blast out in 1 second compared to the total air you can blow out is less than 70%, and this is important, it's still that low after you've used an inhaler to open your airways up, well, that confirms it. That's a persistent, irreversible airflow limitation. That's the official diagnosis of COPD. So, getting the diagnosis is the first step. But what comes next is the fight. It's a strategic battle to manage the disease, make life better, and slow this thing down. And the good news is, there is a very clear plan of attack. The whole management strategy really rests on three main pillars. First, and this is the absolute non-negotiable one, stop the damage. That means quitting smoking. Period. Second, use medicines called bronchodilators. These help relax and open up those airways to make every breath just a little bit easier. And third, strengthen your whole system through something called pulmonary rehab. It's an amazing program of exercise, education, and support that's been proven to help people feel and do so much more. On top of those big three, there are a few other essential shields you need in this fight. Getting a flu shot every year and getting pneumonia vaccines are critical because a simple respiratory infection can be just devastating when you have COPD. And other things, like learning how to use your inhaler the right way and knowing when it's time to call the doctor, they make a massive difference. So where does all this lead? It's a natural question to ask. What does the future look like? And while doctors have tools to help predict the course of the disease, I want you to remember this. A prognosis is not your destiny. It's a projection, and it's a projection that you can help change. One of those tools is something called the Bode Index. It's a really clever acronym that pulls together 4 key pieces of the puzzle to create a score. B is for body mass index. O is for the level of airflow obstruction, that number from the spirometry test. D is for dyspnea, which is just the medical term for how breathless you feel. And E is for your exercise capacity. You add it all up, and a higher score generally points to a tougher road ahead. And this right here, this brings us to the most vital message of all. The source material says it perfectly. Yeah, the disease is progressive, but the prognosis, the outcome, is variable. What does it depend on? It depends so much on how well a person sticks with their treatment plan, quitting smoking, taking the meds, doing the rehab. What you do matters a lot. And that kind of leaves us all with a final thought, doesn't it? The Bode Index is for COPD, sure, but the idea behind it is universal. If you could see a score, a single number that represented your future health, what steps would you take starting today to change that number for the better? It's a powerful question to think about. Thanks for tuning in.